Well, welcome back. This is Viewer Mail Thursday here at the Infertility Channel. My name is Randall Loy, and of the millions and millions of sites on the internet, you have found me. That's amazing, but thank you. Anyway, so we have had a lot of fun with this segment, and I have no clue what questions you're going to be asking, but my good friend is going to be handing me these questions momentarily. There we go, good friend. Okay. This is from Maria in New York City. Can regular consumption of alcohol make me infertile? As opposed to irregular consumption, or maybe consumption of irregular alcohol. That's especially bad. So can regular consumption of alcohol make me infertile? That's a terrific question. And you know, probably not is the quick answer, unless one is consuming massive volumes. I had a true story a few weeks ago. This good old boy here from kind of the outback in Florida, he said, "Hey doc, I want to tell you something I'm real happy with myself." He said, "I'm down to 35 to 40 beers a week." And I said, "Well, how many were you drinking?" He goes, "Oh, I was up to 50 or 60 at one point." And I said, "Good gracious." Well, we know that once men drink probably more than 20 glasses of wine or beer a week, it can certainly have problems for sperm production. Not nearly that many maybe for egg cell quality. So I would advise you to, in the time that you're trying to conceive, not to drink any alcohol. And of course the threshold is 0 for pregnancy, so please don't drink in pregnancy. Maybe if you want to have a glass of wine or beer, certainly okay on your period, but I would say the regular consumption of alcohol is not to be encouraged if you're trying to have a baby, and certainly not if you're pregnant. From a medicinal point of view, if we can say medicinal alcohol intake, probably the max for a woman would be 3, 4, 5 glasses of wine or beer per week. For a male, maybe 7 or 8. Above that, for a woman, seems to have increased risk for breast cancer. So anyway, that's it for Maria. Next is Briana from Port Charles, Louisiana. Does insurance generally cover infertility treatments? Typically, no. Now, there are some states that have mandated coverage. We're not sure what that means in the time of the Affordable Care Act or Obamacare. All that could be changing. But in general, insurance does not cover most infertility treatments. So, you know, we, for example, have scores of different insurance carriers that we deal with on a daily basis, and coverage is actually quite spotty. Some of them will cover an ultrasound or a diagnostic test, or some cover all diagnostic testing but no therapies. Others will cover medications but not IVF. So anyway, check with your particular insurance carrier. Try to speak, if you can, to a woman in the department and tell her about your infertility situation, and maybe she can help cover your particular benefits, help you understand those better. So next is Karen from Boulder, Colorado. I've heard after going through treatment and having a baby, there's a chance I could get pregnant again on her own. How common is this? Actually, it's not uncommon. And it could be that there are conditions that pregnancy helps. For example, we know that endometriosis, the high estrogen and progesterone levels of endometriosis, can actually decrease the inflammation associated with endometriosis, so some patients with endometriosis are able to conceive again. How about ovulation dysfunction? Yes, some patients who have had irregular cycles might have more regular cycles for the months following completion of pregnancy. Some patients with unexplained infertility or anxiety-related ovulation dysfunction may in fact ovulate better after the baby's born. So there are conditions, and it's not uncommon that one can conceive naturally after requiring treatment in a first pregnancy. The next question is from Priscilla from Whittier, California. Should I keep a diary of my temperature, my husband's ejaculation, and how often we have sex? Sure, but don't tell him. I mean, these are things that women talk about, but men don't. So there are good reasons to keep a so-called basal body temperature chart. These are special thermometers. You can't take one off the shelf, a regular thermometer. Make sure it's an oral thermometer that has a very tight range of between about 96 and 99 degrees. That's one of the first steps. You can see if your basal body temperature is so-called biphasic. In other words, it should be lower, around 97 degrees in the first half of the cycle. it'll dip down a little bit, and then with the second half of the cycle, with progesterone release after ovulation, that temperature is going to be higher. We like to see the second half of that graph be at least 11 days long, where it's higher, and we'd like to even see it continue, suggesting pregnancy. With the period, however, the temperature will fall. Very important if you're keeping a base of body temperature to do that in the morning before you've gotten up and had that cup of coffee. That cup of coffee from Starbucks will elevate your temperature quite nicely. You don't want to be 105 or 110 degrees. Your husband's ejaculation, I don't know if you want to keep a diary of that. How often you have sex, I think that's fine. Now, in terms of the definition for infertility, it is having unprotected intercourse 2 to 3 times a week for 52 weeks without conception. And that would be for a woman who's younger than 35, and if you're 35 and older, we typically say for 6 months. Wow, Jonathan from Fox River. This is a male. Please note this. This is Jonathan from Fox River Grove, Illinois. Are there certain positions that are better for conception? It's basically any position where the sperm can be deposited into the vagina, and by gravity, most of those don't fall out. The old missionary position is fine, knee chest position is fine. Basically, probably anything goes, again, where most of the sperm are not going to fall out by gravity. And Jonathan from Fox River Grove, Illinois, you can figure that out for yourself. Just remember Newton's laws, gravity, sperm have to stay inside to make babies. Thanks a lot for these questions. I had a lot of fun with these today. Next week, we're going to be talking about multiple pregnancy and how to avoid that in the IVF setting. Look forward to seeing you then. Thanks so much. Be sure to share this video with your friends and subscribe to catch all new episodes each week here on the Infertility Channel. Plus, follow us on Facebook and Twitter. I love hearing from you. Comment below or tell me what you want to see on future episodes by sending me an email to comments@infertilitychannel.org. Until next week.